Hi there. Can you tell us where we're at right now?
At UCSD Thornton Hospital.
We're at the UCSD Thornton Hospital, and I am with the social worker for the Geriatric Behavioral Health Center. I first have to ask you, what got you interested in wanting to work with seniors in behavioral health?
Okay, well, first we're at the Senior Behavioral Health Intensive Outpatient Program, and do you want to know anything about the program? Or
I would love to hear about the program, yeah.
Okay, so this was a program that was opened as a continuation of care from the UCSD inpatient unit, behavioral health for seniors. And often when they had gone there for severe depression or suicide attempts, they need somewhere to go after they've completed their hospitalization. So they come to us for intensive outpatient program, and that's where we run group therapy for them.
Is there any individual therapy as well?
Yes, there is.
And so you are a social worker that conducts that group or individual therapy?
So yes, I'm a licensed clinical social worker, which means I'm board certified as a psychotherapist. And yes, I run group therapy, men's, women's, some mix, and some individual therapy.
That's wonderful. If you could say, what are some of the common reasons why seniors come to see you?
Again, they're often coming from inpatient, and they have been inpatient because of often it's suicidal ideation, even more often actual suicide attempts. Gratefully that most of them don't succeed. And a lot of them are really just dealing with the process of aging and the losses of friends. A lot of times it's being widowed, spouses, long-term spouses having passed away, and just dealing with that extreme adjustment in their lives of aging, loss, and also physical disabilities and new diseases that pop up, and just trying to deal with being a senior and all of the losses that just feel like they're coming at them too fast.
Well, I mean, these issues, mental health, especially with seniors, with all the changes, is so critical today, and getting the awareness out that seniors do need to come see you. What, if you don't mind saying, what are some of the suggestions that you might have for seniors that are dealing with loss or dealing with depression?
Well, I'm coming straight out of hospice, and that's kind of the natural progression. How I ended up here was I dealt with a lot of hospice, and I was a therapist for hospice and for the terminally ill, and many of them were aged and aging, and their problems seem to be very similar to the folks who are not dying, but the aging and the loss stuff is so similar that I do a lot of grief therapy, a lot of compassion therapy, just a lot of empathy of letting them know that this is the aging process, and where they are is okay to be there. Also that the social element is so important that they end up self-isolating either in their homes alone or even in the nursing homes, but still self-isolating. So I try to really encourage them to come to group twice a week. It's intensive, it's 6 hours a week, and the social aspect that even grows from the group, aside from the cognitive and the psychological aspect, is so good for them that you can just kind of see them light up after they realize they belong somewhere and that other people are suffering the way they are suffering. And I just really encourage them to listen to the other people in the group and other people around their ages that are suffering from similar things, and to really kind of unite about that and find fun and creative ways to kind of combat against that.
And so men and women, average age, is it mostly men, mostly women that you see?
Very divided.
Yeah.
I'd say 50-50, and our age group, in order to qualify for our program, they have to be on Medicare and a minimum of 65 years old. So right now my patients are 65 to 93. I actually have a 89 and a 93-year-old, so there is no limit.
Wow, that's so critical. What would be your advice, I guess, for a senior that just lost a loved one that is having a difficult time?
One of the first things I say to them is to remember that they're in crisis. This is true crisis that's going on. They're probably traumatized from the death or however the death happened, whether it was expected or unexpected, and to just be in the moment of realizing that this is crisis, and this means that every minute that goes by is one more moment that they have survived this horrible thing, and that They need to take care of themselves now in the same capacity and the same caring that they took care of their loved one while they were dying. So that's the main thing I start is get through 5 minutes and recognize the 5 minutes when it's gone, and to not isolate and just treat yourself as though you are critically ill yourself, because that's how severe grief is. It's like being critically ill yourself.
I think that's a great suggestion. And so you see many seniors throughout your practice, and would you have any advice on successful aging, or aging happily, aging well, to someone?
Yes. If the person has been active their whole life, they're most likely going to keep being active in different ways. And when it seems like the physical body is getting more fragile, I try to help them understand that it's not too late to start investing in the internal, investing maybe more in the spiritual, more into the friendships, into the relationships, fostering some new relationships with their children that they might not have, especially with their grandchildren at all. That the grandchildren bring so much life and joy to their lives, and sometimes they feel like they don't belong with the grandchildren, that the grandchildren are too young or whatever. So I really encourage them to foster new relationships, and even start to invest in things like, if they've always wanted to play the piano, then go and take a lesson and play the piano. If they've always wanted to go to Broadway plays, if they can get on a plane, go and take that trip. So literally not letting go of the old, but just enhancing the old and being not afraid of starting brand new things and really being excited about that.
I mean, I think that's great. And you are such a great facilitator of high energy and uplifting, and we appreciate all that you do. As far as seniors knowing about the program, the Geriatric Mental Health, Behavioral Health, how do you market? Do you know?
I market to people like you.
Yeah.
And people come to me, and I also go out to the hospitals. I go to different the psychiatrists and departments of psychiatry of the hospitals in the area. I market with home care agencies, and let's see what else. There are marketing network meetings out there that we go to that kind of everyone from the senior field come to. And
what about those that are on Medi-Cal? You mentioned Medicare. This is covered. Is Medi-Cal also?
We take minimal, actually, Medi-Cal. I do believe that if there is anything that we need more of right now, and again, our program is pretty new, only a couple years old, and very, very small. So financially, we're just barely solvent. So Medi-Cal reimburses so much less that no, we do have a hard time taking Medi-Cal patients, but we do take maybe 2 or 3 a year. And so does the psychiatrist that we work with. But yes, I think if anything, there is a need for more Medi-Cal-based senior care, definitely.
Well, so you've been here for almost 4 years.
Yes.
And I'm sure it gives you so much joy to see your patients come in on day one and leave whenever it is their treatment might be up, so much healthier and happier. I think the work you're doing is truly incredible.
And seeing the depression lift after literally a suicide attempt, or really teaching them some relaxation skills or meditation skills for their panic, anxiety and panic attacks, and just watching them get a little bit more whole and a little bit more peaceful, and really making a couple friends within their own program. It does change their lives, and yes, it's very, very satisfying.
And I think that's great. I think the last question I have is, would you have any advice for future professionals that are social workers that would want to get into senior behavioral health?
Maybe a lot of patience. Be ready for the type of care that you don't see a lot of change quickly. If you want to do the kind of quick fix stuff, this is not it. Working with seniors is not a quick fix, and being able to be strong enough in your own self-esteem of your own profession to not feel badly if you don't see them get so much better that they're out, dancing the jig. So yes, if you're going to go into the geriatrics, a lot of patience, a lot of compassion, and being okay with not a lot of radical change.
I think that's great. Again, Judy, thank you so much for your time and all that you do. Thank you so much.
You're very welcome.